Unexpected bills, never pleasant. During the holidays, that much worse. Nearly 200 counselors who provide mental health help for low-income and minority communities in Colorado are being asked to return tens of thousands of dollars to Medicaid. Now, whether this is a mistake by the state or by those counselors, there are vulnerable Coloradans caught in the middle. Marshall Zellinger explains.
Medicaid is complicated. This story about Medicaid is about money.
In my case was around $18,000.
For over $17,000.
Brenda Renfro and Diane Melendez provide mental health services for people on Medicaid.
For me, the benefit was that I had access to a lot of Latinos that otherwise don't get services.
Our Medicaid clients really are those who are either unemployed or they're employed, but their income is a low income.
Seeing someone on Medicaid usually comes with a lower reimbursement than seeing someone with private insurance. After each client, the provider, in this case Diane or Brenda, submit a reimbursement form. Now they're getting bills to pay Medicaid back for services they say they provided.
They were saying that it wasn't entered correctly. The claims that they paid us wasn't entered correctly, with one box in particular, 24J, being missing.
24J is where a provider's unique ID number needs to be input. It basically tells Medicaid this is the person who provided the service we're reimbursing them for. In July 2019, Colorado Community Health Alliance, the group that handles Medicaid for certain Colorado counties, discovered the claim forms did not include the mandatory 24J. CCHA used newsletters to tell providers to start filling out their unique ID number. For those who didn't, Medicaid will seek money back, which leads us to the letters Diane and Brenda and 197 others have received.
We feel, that we're being accused of fraud for not having a number in a box. It's sad and it's difficult. It's very frustrating.
Diane said she submitted claims with her unique ID number. Brenda says she tried.
I wasn't able to fix any of them.
They have until the end of the year to pay back the money or dispute the claims. If they do nothing, starting next year, anytime they submit reimbursement for Medicaid clients, that amount will be deducted from the amount they're supposed to pay back. And that impacts more than just the provider.
I feel like I don't want to take more Medicaid clients.
For us to have that money taken back and to see the clients, it's not sustainable.
The state tells me that these providers can still remedy this by submitting the claims again with that unique ID number by the end of the year. I didn't see that on the letter they got, but I heard from one provider who said it was like a full-time job for one full week resubmitting the claims. Bottom line, Kyle, it's the clients who are at risk of missing out if providers start bailing on Medicaid because it's too complicated.
Yeah, I feel like, listen, I understand they want resolution, but my biggest concern is if somebody goes to seek care and can't get it because of this.
And there have been a number of changes, according to the providers of Medicaid, that have happened during COVID that are getting some of them leery of being Medicaid providers. And we could talk about insurance for an entire show and still not make sense of it, but if you have fewer people offering services for that select population, you're going to have issues about trying to get in. Hey, I need to see someone for my mental health. I can't because there are fewer people to choose from.
All right. Please keep us apprised of how this one sorts out. Marshall, thank you.